Hello, everyone, and welcome to another episode of IBD Heal, a podcast brought to you by High Carb Health. Today, we're going to be doing something different. This is a new podcast series called Save the Gut with me and Dr. Vrushali. It's going to be slightly different in the format, and Dr. Vrushali is going to be interviewing me with questions that a doctor would be asking about nutrition and IBD. So I'll let you introduce the series, Dr. Vrushali, about how we're going to be handling this Save the Gut series of interviews.
Hi, Shukul. Nice to meet you again. And yeah, this time I'm sitting with you, to kind of have a few questions regarding what we as doctors usually face from patients who are suffering from gut disorders like IBD, IBS, SIBO, and sometimes, kind of indigestion and gastroenteritis. So, dealing specifically as a gut health nutritionist, your entire focus and emphasis in healing people is to try to make them feel good with the kind of fiber that they are having. Am I right?
That's part of it, definitely. And fiber plays such an important role in people's gut health. So if we're not considering the importance of fiber in somebody's diet, we're doing them a disservice, right? So it's not the entire aspect of what we're doing, but it makes up such a big component of the education of getting people to understand how their gut heals and also functions, right? Because without fiber, we're not allowing our gut to function in the optimal way. So fiber plays a really, really important role in the digestive process, in the body's ability to heal. And as we go through this interview, we'll be discussing. I'm sure you've got some very interesting questions about fiber's role in the ability of the body to heal. So, we'll be covering all of those things as we go through the different questions you have.
I'm glad you're there for us. And, what happens is most of the times we face patients and, specifically people, with having these gut inflammation because the most important aspect of their life and which is food and nutrition gets very badly affected. And most of the times patients also do complain about having exacerbation of symptoms with the introduction of fiber. So that is a little bit of kind of a tricky or a patchy area that we go through. And it also becomes difficult for the patients to stick to high fiber diet at times. But we are very glad that we have someone like you to work with us and, kind of handhold our patients through this journey to kind of take them to the place where they kind of can heal their gut and digest a variety of foods. So what exactly are, these kind of, what are the types of fibers which are available in the food? Could you please emphasize?
Absolutely. So there's two main types of fibers that we have in plant foods because the only types of foods that have fiber are plants, right? The fiber is the makeup of the plant and what holds it together. And so
Mhm.
if you want fiber in your diet, you have to have a type of plant food. It doesn't come in animal food. So um, contrary to some people's belief, that some people believe that there is fiber in animal food, there is no fiber in any kind of animal food. So first of all, if you want fiber, you need to eat a type of plant. Okay. Now, in terms of the types of fiber that we find in plant foods, there are two main types of fibers. One is a soluble fiber, and the other is insoluble fiber.
Mhm.
Now, most plants will have, well, all plants have both types of fiber included, but some plants are higher in soluble fibers, and some plants are higher in insoluble fibers. So now, if we want to think about a visualization of how these two fibers look, right? So a soluble fiber is something that kind of dissolves. It's very soft. It's like a jelly type substance in the gut. Okay, it's very easy for the body to process this type of fiber and digest it. It doesn't cause a lot of irritation to the gut. And so when the gut is inflamed, we would really try and recommend people to focus on fiber plants or foods that are higher in concentration of soluble fiber rather than the
Mhm.
insoluble fiber. So if we think about insoluble fiber, we are thinking of fibers that are more rough. So we think about foods that have a lot of roughage in them. So leafy greens, raw leafy greens, the harder types of plants, broccolis and these kind of foods that if eaten raw and
Mhm.
have a large amount of insoluble fiber, these are the types of fibers that can irritate people's guts. So when people say that, oh, I'm eating more fiber and I'm getting more discomfort or irritation, they haven't really differentiated between soluble and insoluble fiber, right? And
Mm-hmm.
so if you try and lump all fiber into one kind of section, then you're not understanding necessarily what to eat if your gut is inflamed. Okay. And if you're eating a lot of raw foods or eating a lot of insoluble fibers, like, for example, like even rice, grains, like brown rice especially, has a lot of sharp edges to that fiber, right? It's not a very soft grain, like not a very soft food if you compare it to a banana, right?
Mm-hmm.
Now, even if it's cooked, if I was to squash some rice between my fingers, it would still be quite grainy and harsh. Whereas if I squash some banana in between my fingers, it's very soft like a cream. Okay. And so if you think about the type of fiber you want to be passing through a gut that is sore and inflamed, right, is injured in a way,
Mm-hmm.
then we have to be very considerate about the type of fiber that we introduce into that patient's or that client's intestinal tract. So those are the two types of fibers that we're mainly exposed to, and we have to be very careful depending on what types of symptoms someone is exhibiting as to what type of food we can introduce into their gut. And so
Right.
with someone who's going through a flare up or has a lot of symptoms and has some pain or irritation in their digestive tract, we would really be focusing on maximizing the foods that have soluble fibers, bananas and fruits that are soft, you know, um, sweet potatoes, pumpkins and squash and gourds and these kind of foods that are a lot softer, smoother, easier to digest, and they will cause a lot less irritation to the gut for this type of person. I hope that answered the question.
Yeah, yeah, of course. You've given me a very nice overlay of what exactly, the kind of fiber is. To get on to the next part of this uh, series of, answering questions on fiber, is there a role of the physical form in which the fibers are introduced, like blended, juiced? I want to know more about that because some patients they may not be able to digest solid food at all, isn't it?
Mm.
So how do you in high carb health help patients with active gut inflammation um, kind of digest this fiber slowly?
Yeah, so that's a very interesting question. So yes, some people that are going through a lot of symptomatic trauma in their lives and having very difficult with any type of solid food, right? They have to start somewhere. So generally, if they're really struggling to consume fibers, we may start with just a juice protocol for a few days. Maybe that allows the gut to calm down a little bit. It may soothe the gut so because no food's going through there for a little while. But what we find in the majority of situations is that smoothies seem to be the easiest for the body to deal with because
Mhm.
you may even put someone on a water cleanse or a juice cleanse or something like that, but that may not resolve the symptoms. And somebody needs to eat. You can't just not eat anything, right? So the softest type of fiber, like a banana smoothie,
Mhm.
seems to be the easiest for this person to digest. And, you may not resolve their symptoms immediately with the banana smoothie, but you are giving that gut the easiest passage it possibly can get to digest that food, right? So soups, even like, like a sweet potato and pumpkin or butternut squash soup, something that's very soft, like almost purees of baby foods, like what you would feed a baby when they're getting introduced to solids is kind of what you need to be looking at doing for someone whose gut is very inflamed, sore, and irritated, and they're really struggling to deal with any food. So unfortunately, it's not like any other type of chronic inflammatory illness where, for example, an arthritis where the inflammation is in the joint, right? It doesn't matter what that person eats, the the food is not affecting the injured area or the damaged area of the body.
Mhm.
With IBD, it's what makes it such a challenging disease to work with is that you have to eat something, and so the food has to
Yeah,
pass through the affected area of the body. And so what we do at High Carb Health is we're trying to just uh, depending on that person's symptoms, we're trying to see, okay, what is the food that is going to be the easiest for this person's gut to manage, right? And then as their gut gets stronger and stronger, we can start to introduce more complicated or more complex types of foods. But yeah, if someone is in a really, really tricky situation and they're struggling to consume anything, then you may smoothies or soups or purees are generally the easiest types of foods or types of fiber for for them to deal with initially. Mm.
right. Is there anything like a minimum, quantity of fiber? Is there any quantification of fiber that a person should have and should not exceed that particular quantity of fiber per day, especially the ones with abnormal guts?
I don't think so. In my experience, it doesn't seem to be a big issue. I think it's the type of fiber or the type of food that you consume. Now, typically, if someone is really unwell and they have a lot of gut distress, their appetite will
Hmm.
be very suppressed in general. So they may not want to eat a lot of food. So automatically, the body will identify that, okay, I don't want to put too much stress on the gut right now. And so they may not be able to eat larger quantities anyway. So we just try to
Yeah.
get them to eat as much as they possibly can manage based on their appetite level, but also trying to make sure that they are not finding themselves in a dangerous position in terms of their weight and things like that. So there's a balancing act that we have to take into account. But no, in our experience, like the more fiber somebody gets, the better it is because fiber is fiber is feeding the microbiome. Fiber is feeding the bacteria that we want. And so
Mhm.
if we can the initial phase of somebody's journey with us would be a little testing phase to see, okay, which foods are, exacerbating the symptoms, which foods are not, and then we'll find what foods are safer for them to eat, and then we will
Mhm.
increase the quantities of those, and to help them maintain weight, to help them build their microbiome, to help them get enough nutrition in their diet, we need to maximize the safe types of fibers that they can manage because otherwise they'll go into a depletion state and that's not a good place. It's a dangerous place for anyone to be in. So no, I don't think there's any specific maximum amount of fiber that someone should eat. They should eat what's comfortable for them. And as far as I'm concerned, the more that you can get into your diet, the better it is because there's all these flow-on benefits that we may talk on as we go through the interview. But the major benefit is that when the bacteria in your gut, when they ferment the fiber, they produce these wonderful short chain fatty acids that are very important for the healing of our gut lining, and they're the things that help us uh, improve the leaky gut or the gut permeability that exists with IBD. And so
Right.
you're right, if we're not getting these fibers, then we're not
Yeah.
allowing our gut to heal in the appropriate manner. And so we really need to focus on doing that.
There is one particular question that a lot of times, we face in the clinical setting, and that's similar to a chicken and an egg theory, right? So what happens is when we speak about short chain fatty acids,
Hmm.
colon or the small intestine, large intestine, they need to be inoculated with the bacteria, basically the good type of bacteria that break these fibers, the soluble and the insoluble. Of course, the insoluble do not get broken, if
Hmm.
I'm not, correct me if I'm wrong, and they directly reach the colon. But for some reason, if there is a severe amount of dysbiosis in a patient's gut because of the wrong food habits or lack of awareness, or there could be a lot of inflammation in the gut, and the leaky gut, which you kind of very commonly call it. If there is not much of good bacteria,
Hmm.
so in that case, how do you think is you guys customize the diet protocol in these patients so that they do not get too many symptoms because fermentation, digestion, all these need a lot of
Hmm.
good bacteria.
Hmm.
And someone who doesn't have them is definitely going to pass it as it gets entered. So I would want you to reflect a little bit on that. Like someone doesn't have a good bacteria in those patients, how do we customize the introduction of fiber?
So there's only one way to improve the gut bacterial diversity, right?
Yeah.
And that is to feed the good bacteria with fiber and starve out the bad bacteria that are causing the dysbiosis. Okay, so the
Hmm.
first thing that needs to be done is that we cannot continue to feed the bad or the dysbiotic bacteria. I don't like to call them good or bad because they all have, even the so-called bad bacteria, they have a role to play in our gut, right? They're not,
Hmm.
it's only bad when they overgrow their symbiotics numbers, right? And that's what happens in dysbiosis. We get an overgrowth of bacteria that we don't want to have in that type of number, and so those kind of E. coli's and salmonellas and Bilophila wadsworthias and things like that are important in certain amount, but when their population grows above that symbiotic level, that's when we start to get disturbances and dysbiosis. So um, we need to make sure that we are feeding back we are feeding those bacteria in a controlled manner, right?
Hmm.
By giving them fiber that this person can handle, right? Ideally, for someone that doesn't have digestive distress, we want to be eating at least 30 different types of plants a week. Okay?
Hmm.
That is what the research shows us. The people that eat at least 30 different types of fibers or plants in a week are the ones that have the best microbial diversity. Okay. However, someone who has got digestive distress through IBD or any other form of digestive disorder, they may not be a good candidate to pump 30 different types of fiber into their gut in a week, right? We have to start with the safe types of fiber, start to starve out the bad bacteria by not feeding them. And how do we feed the bacteria? Foods that don't have fiber, right? So the foods that don't have fiber, meat, dairy, eggs, fish, oil, junk foods that are devoid of nutrients and fibers. These are the foods that are feeding your bad or dysbiotic bacteria. So first of all, we got to stop all those foods, right? And then we need to see, okay, what types of fiber are going to be safe for this person's gut to handle? And then we start off with those types of fibers initially. So soft soluble fibers are always the safest bet. Okay. And you may, again, like I know from a medical perspective, we're always trying to minimize symptoms, but from our
Yeah.
perspective, symptoms aren't always the enemy, right? For example, if I'll just give you an example. I had a shoulder injury recently, right? And the symptoms of that were pain and discomfort, and if I moved the shoulder in the wrong way, it would hurt more and inflame more, right? But that inflammation was a necessary part of the repair of my shoulder, right? And no one from a medical perspective would disagree that the inflammation is necessary to repair the damage or the sprain that's happened to my AC joint, right?
Hmm.
So when we look at the gut, we seem to think that inflammation is always a bad thing if it's in the gut, but if it's in a different part of the body, it's a healing process. So we may not necessarily we don't want it to prolong for long, long periods of time. Like if this
Hmm.
shoulder stayed inflamed for years and years and years, that wouldn't be a good thing, right? We want the
Yeah.
inflammation to do the job that it needs to do and let that part of the body heal. And we need to
Hmm.
give it the right conditions to let that area heal. So food can play a very important role in allowing the gut to have the right conditions to heal. And so the right types of fibers cause the least amount of irritation and that cause the least amount of irritation in the gut will be very important to allow it to heal. And so in terms of providing the microbiome a chance to repair and regenerate, we start with the safe fibers that this person is handling without any exacerbation in symptoms. Okay, so this person may already be having a certain amount of symptoms before we started the protocol. And so we're
Hmm.
looking to introduce certain foods that aren't going to make that worse. So if we can introduce certain fibers and keep the symptoms at a similar level or see an improvement, that's a good start, right? And so we will do that. And then as we start to give the body the right types of food, it will start to heal. and will start to repair. And then as the gut and the symptoms become less and less, we can start to introduce more and more diversity into this person's diet. And by doing that, eventually we will get them to eating 30 plus different types of plants, and that will really build the microbiome into where we really want it to be. So it may not be like a instant process, but we need the body um, to have these type of bacteria um, ensconced into the mucosa, right?
Mhm.
It That's the way the microbiome really works. When we've got good diversity of bacteria inside the mucosal lining, we don't
Mhm.
want necessarily bacteria in our outside of that because they're not doing the same job. Okay, and that's why we really prefer prebiotic fibers, right? So fiber is a prebiotic, so it feeds the bacteria, and this increases the bacterial population as that bacteria gets more and more sustenance. Um, and we don't like to focus on probiotics, which is to introduce bacterial populations into the gut, because we do not know, the research does not show us whether these bacteria actually make it into the mucosal lining or not. Okay, so we can have someone take a probiotic supplement and do a stool test, but we do not know for sure that that
Mhm.
increase in bacterial population has it just come in from one side and gone out the other, and it's in the
Yeah.
stool. So we say, oh wow, this is great. We see this increase in bacteria, but that's because we've taken a
Mhm.
supplement. It may not be in, actually ensconced into our body the way it's supposed to be,
Yeah. It
right?
hasn't colonized,
Yeah.
and it hasn't made its home in the
Mm.
place it's supposed to do its job.
Whereas with prebiotics, we know that it will do that.
Right. So you do not advocate taking any probiotics for a patient who has active inflammation, and
Mm.
sometimes, there are a lot of tests that get run across the world, which tell us that, there is a series of dysbiosis, isn't it? And then there is a lot of less amount of good bacteria and a lot amount of less good bacteria and a lot more amount of worst bacteria.
Mm.
So by adding probiotics in the diet, it doesn't necessarily ensure that the outcome is
Mm.
going to get better.
No.
Because
Yeah,
why does that happen?
because we
When
don't know whether it's actually colonized into the mucosa of that person's gut. And we used to actually work with a person who specialized in looking at these microbiome tests,
Mhm.
right? And they would say, okay, this person has, uh, this is a deficiency in this type of bacteria, and we need to think about how to get more of this bacteria into their gut, right? Um, and or if there's a type of parasitic bacteria or pathogenic bacteria in there, we need to try and use a type of, a lot of people use these kind of things like golden seal or berberine and things like that into the gut. In our experience, it did not solve the problem that the person had. Okay. And the only thing that we find that resolves the situation is time,
Mhm.
right? Giving the body the right conditions, eating the right types of food over a period of time is the only
Mhm.
thing in our experience. We're doing this for a long time, more than 10 years, is the only thing that resolves microbial dialysis for good, long term. Right? You can try and shortcut it, you can try and quick fix it. In our experience, they don't do the job, and they can have negative consequences if you're taking some of these things. Like probiotics can have negative consequences. It's not just you take it and there could be nothing that happens. You could colonize too many of a particular type of bacteria, and they push these other bacteria that you want out of the gut,
Mhm.
right? And so that's also not a good balance. So if we let the body create that balance automatically, the way it's supposed to naturally do it,
Mhm.
right? That is the best way from our experience.
Got it. Sometimes, the road is not that straightforward, and we do encounter clients or patients with complications of IBD or
Hmm.
long-standing gut inflammation. That there might be strictures, We together we saw a patient with fistula, isn't it? Now, for those patients, how long does your program basically last for? Is something that we would like to know. And how much does introduction of fiber and anti-inflammatory diet through high carb health protocol help in, one is reducing the inflammation, second is reversing the inflammation, and third is restoring the normal anatomy and physiology of the gut.
Well, that's a good question because that's how long is a piece of string, really? Because it all depends on
The
so many
first is
different
that
factors.
does it, yeah, so does these protocols kind of go that far that if it becomes like a long-term lifestyle change, it may reduce, um, kind of reverse, and the third is also restore, is what I would like to
Absolutely.
know, because that is our goal. That is our goal. We don't want to leave a patient with a fistula, being there, because that's another part of the medical care, we have to get
Mm,
through. So
mm.
I want you to reflect on those aspects of healing as a nutritionist, if possible, please.
Yes, we've seen all three of those things happen. So we do reduction is the easiest one, right? Um, what was the other one you said? Reverse, right? And
Yes.
then restore, right? Those three. So reduction is the first thing that happens quite easily. Um,
How early does that happen in your
oh,
experience if someone starts on something that you advise?
it really depends on how severe their condition is and what they've done before they've started with us. Okay, so if they've come to us in a remission state and they're on a particular type of medication that's been effective, but they're not healed, they've still got some symptoms, that can happen. We can see reduction happen in a matter of days or weeks. Okay, if somebody has been on a very long-term use of biological medication, infusions, they've tried 4 or 5 of these different type of biologics, and none of them have worked, and they're highly inflamed, and they've got a lot of toxic damage to their bodies. Uh, that can take a bit longer to see a reduction, right? So it wholly depends on a number of factors as to how long it can take somebody to get better. One is how long have they been diagnosed for? So how long have they had the disease for? Secondly, how long have they been on medication for, and what types of medication have they taken, right? Because if the body's been exposed to 4, 5, 6 different types of biological drugs, then all of these been pumped into the system, and they're in there. They need to be removed, right? And then it could be severity of symptoms as well. So, yeah, I would say if you're going to give me like an average, okay, if I was to give you an average, like you can't, not everybody's going to fall under this umbrella, but for the vast majority of the people that we work with, once they stop the medication, they can see reversal somewhere between 2 and 4 months. All right. Once they stop the medication, these are like more common cases. If you haven't had it for, more, it's probably less than between 5 and 10 years or less. You haven't taken any biologics, or you've only taken 1 or 2 of them. Um, the disease has not been overly complex or difficult. Um, for the vast majority of those people, they'll see results reasonably fast. More complicated cases, you can be looking between 6 and 18 months to see reversal. You'd see reduction before that, um, but yeah, it could take up to that long, and it also depends on how safe it is to take them off their medication, how fast they can get off their medication. All these kind of things play a big role. Yeah.
Yeah, that's a very good hope for people, who have complications, because
Mm.
like strictures. So how do you
Yes.
normally how do you normally approach the diet and the introduction of fiber in patients who have strictures, like especially in Crohn's,
Yeah.
long-standing?
Yes. So that's a very good question. That is something that you got to be very careful with. Okay. So when you first need to make sure that it's whether the stricture is a narrowing or a blockage. Okay, if it's a blockage, then they need to get medical attention and make sure that, food can pass through there. If it's a
Yeah.
narrowing, then you've got to think about, okay, how can I give them the foods that are going to pass through this, so we don't want to give them too many big chunks of food, or we don't want to give them foods that are, going to be a bit harder to push through, like, so softer foods, purees, soups, these kind of things to allow the body to reverse the damage. And we'd like to think that over time, that's the narrowing will reduce and you'll get more of a gap to push foods through that area. It may not ever be 100% to where it would have been before the damage was caused in the first place, but we see people get very good results and they can eat once the inflammation is reduced and the narrowing is reduced, they can eat a wide variety of foods very comfortably, and they almost feel like it wasn't there. Same thing for fistula. We have worked with a lot of people that have had fistulas. We've had people that have had setons in that fistula, different types of surgeries and things like that. But if you give the body enough time, like Shamiz had about three different fistulas at one point, even though it was colitis and not Crohn's, and they healed. The body can heal itself. We have to give it the right conditions. So, we may need to be a bit more careful if someone's got a fistula to make sure that, we're keeping that area more clean and um, taking care and monitoring it closely. But it does heal. It does heal. You have to, maybe it takes a bit longer for that person than someone who doesn't have a fistula, but it still heals.
Does fiber also play a role in absorption of other nutrients in the body?
It does because you are provided with fiber. So there's two things with nutrient absorption, right? You have certain, obviously the small intestine plays the biggest role in the body being able to absorb nutrients, but there's also certain bacteria that are important in the ability to break down and absorb nutrients as well. And so when we're eating fiber, we are giving our microbiome, we're going to give the body the best form of microbiome, right? So it's the most symbiotic type of bacteria that we need to keep long-term health and to be able to break down the fibers appropriately and to, remove and absorb the best nutrition from that food. But also, the foods with fiber are also the most nutrient-dense foods that we know,
Mhm.
correct? So if we are eating plants, we are getting maximum nutrient density and maximum nutrient diversity in our diets. Okay, so we think about fruits, we think about vegetables, we think of whole grains, we think of legumes, small amounts of nuts and seeds. We're getting a wide variety of huge amount of different types of nutrients. We're getting antioxidants in abundance. We're getting
Mhm.
polyphenols in abundance, right? We're getting all these
Mhm.
different micronutrients from our foods that the absorption of nutrition is always going to be better if we include fiber in our diet.
Mhm.
All right. Not only are we getting a more nutrient dense diet, but we're also maximizing the bacterial microbiome, who will then also give us benefits in forms of absorption of nutrients. And then they produce different types of um, chemical compounds as well into our body. Like, for example, the amino acid tryptophan is
Mhm.
responsible for serotonin production in our brain.
Mhm.
Okay. Um, we know that when we eat plants, the concentration of tryptophan is higher compared to animal foods. So the amount of serotonin produced when we eat things like plants is much greater. And so, like, for
Mhm.
example, bananas, they call it the happy food. It helps lift our mood. So when we eat more plant-based foods, we see so many different benefits, not only nutritionally, but also hormonally. We're not affecting our hormones. And I think from your perspective, as someone who deals with that quite a lot, you don't want to be putting hormones from different types of animals into our bodies either. So if eating plant-based foods that are high in fiber are always going to benefit us in many different ways. It's not just the nutrition that we're getting, it's the way our gut our gut handles the stool, right? With the fiber, bulks up our stool, helps the stool pass easier through our colon as well. So we're more regular, we have less constipation. Um, if we have a lot of diarrhea, the fiber can help bind the stool better, right? So it works both ways. It reduces the constipation, but it also can help with diarrhea.
Yeah, I think what you're talking about is more regularizing the whole phenomena of digestion and
Mm.
evacuation gets more
Yes.
regularized.
Yes,
Anything that is
absolutely.
deviating from normalcy, the fiber holistically works together with its all goodness.
Mm.
Yeah. We as doctors, sorry to say, but we have been given this information that whenever there is a diagnosis of IBD, that is Crohn's and ulcerative colitis,
Mm.
unfortunately, there's not much correlation between diet and IBD. So I want you to reflect on this particular statement so that it enlightens us so that we can better counsel our patients and also give them an advice to see a specialist and an experienced IBD nutritionist like someone like you or whoever is the best possible is that what the patient feels. So I want you to reflect on that statement because we've been thoroughly spoken and told repeatedly that there is no correlation between IBD
Mm.
and diet.
Yeah, I think that's a almost a misnomer. It's that to think that there is no role in diet for a disease that's digestive, right? So I think maybe the comment comes from a lack of research or a lack of understanding into the literature about IBD and diet. It's not it's not hugely extensive like there might be for some other other types of conditions, but there is a growing um, there's a growing number of studies and research papers that do show some very interesting patterns when it comes to diet and IBD. All right. And what we're seeing in the research is that it's backing up, especially as we're doing more and more research on the gut bacteria and the microbiome. But what we're seeing in the research is that when it comes to diet and IBD, the number one risk factor for IBD is animal protein. Okay. And there was a
And
very, very strong, pardon?
animal fat
Yes,
also.
I
Okay.
mean that comes with the fat as well, but animal protein specifically was identified
Hmm.
as a huge risk factor, the number one risk factor when it came to IBD, and there was a very, very strong correlation. Then we also see, yes, fat is another factor because the more fat and saturated fat you have in your diet, we know that it causes more gut permeability. Okay. Uh, we also see that there are implications for dairy, again, another form of animal protein that impacts how the gut operates. And then we look at some of the other factors there. So there's a whole lot of processed types of foods as well that play a role, right? So, for example, we know that maltodextrin, which is a
Mhm.
type of sugar that they use in a lot of like sports gels, a lot of processed foods, right? It's a form of sugar, but it's not as sweet as regular sugar. And this is implicated. This is implicated in IBD, right? And you see a lot of sports people actually get IBD because they're knocking down these gels at a huge rate. Okay. Um, we also see that a lot of these fillers that they put in foods are also implicated in IBD. Okay, so all of the processed junk foods that have, ingredients that you can't understand what they are, when you read them, you think, what is this thing? They have a role to play. Okay, so there is a role, and we have seen through research that the people that eat the most animal foods, they have the higher risks. And when you change the type of protein from animal protein to plant protein, the risk reduces, the symptoms reduce. Okay. There was a study that was done on women that had Crohn's, and the more fruit they had, the better their outcomes were. And the one of the better studies, I know I would like to see this replicated, but in Japan, there's a fellow by the name of Chiba, Dr. Chiba, and he's been doing a lot of research on vegetarian diets and vegan diets and the remission rates and doing some longer term follow-ups. Okay. And so he did a study where he looked at a number of patients who had IBD and they were fed a semi-vegetarian diet, right? And so after the first year of follow-up, 100% of those people were in remission. After the second year of follow-up, 98% of those people were in remission, right? So that was really interesting. And then he's done a follow-up study where he's done what we call educational hospitalization, which is very, very similar to the kind of thing we do at High Carb Health, which is educating the client or the patient as to why they need to make certain changes to their diet, right? Once
Mhm.
they understand the research, understand that the plant-based diet is the most optimal diet for gut health and for your body in general, then they're more likely to make this change, right? So I could tell anybody what to do, right? And they may do it for a short period of time. But if they don't understand why they're doing it, then they may not stick to it, right? So what we're finding through this research and through our own work is that once you educate someone, they're more likely to stay with the program. And so with this educational hospitalization, what they found was even after 5 years of following up with these patients, 81% of those people are still in remission, right? That is exceptional when you compare that to medication.
And all
And
these patients were on medication while they
some of
were
them were on
in.
medication, some of them were not. Uh,
Oh.
but even then, you don't get that. Even if you got 100% of people on medication, even after a
Mhm.
year, like infliximab, right?
Mhm.
The remission rate is 35% after a year. That's only 1 year. This is 5 years and it's 81%. So we can see that diet plays a big role in the treatment and the ability for the for the patient to maintain a good result with IBD, whether they're on medication or not. It still makes a difference.
So, in a situation where there is someone who gets diagnosed with gut inflammation of any category, it could be IBD, it could be pre-IBD. What is your message to us as doctors, as a gut health or a IBD specialist nutritionist?
Well, the first thing to do was to get on to really positive dietary changes as soon as possible. The sooner we make these changes to people's diet, the faster they get better. Okay. So if you think about it, inflammation has been, bubbling away for years and years and years and damaging the gut for years and years and years. It's obviously going to take this person longer to heal that damage than someone who's just been diagnosed. I mean, the ideal situation is for doctors to be educating patients on optimal diets ideally before they get diagnosed. I know that's not their main role. It's in the way the medical system works right now. It's not an educational protocol. It's a safety net. So and that's nothing wrong with that. That's just the way it's designed. But I think people should also take responsibility, try and take responsibility for their own health, and not rely on the doctor you know when something doesn't work, right? Because a lot of people in today's society, they're like, well, I'll just abuse my body to the point where if something breaks, then I'll see the doctor and hope that they fix me, right? And that's not always going to happen. They may be able to reverse your symptoms or improve your certain amount of quality of life, but the medical system is not designed to heal you from chronic illness, right? But if if we can have doctors understanding that the sooner we can nip this in the bud, the better the patient's quality of life will be. That would be a huge improvement in the quality of care that we give to people, right? Um, and and what I see is that, this fixation on protein and fat, even at the hospital level, even with the dietitians in the hospital, telling people to eat the foods that are detrimental to the gut healing is not giving people good results. So we need to get the medical system to understand that ideally we want to maximize plants tell people maximize the plants in your diet, minimize the animal proteins, or eliminate them ideally. Minimize the amount of saturated fat in your diet. Get rid of the junk foods, you know, um, and stop talking about moderation. Because if we start talking about moderation, then we're accepting disease in moderation too, right? If you say everything in moderation, which is quite a common tagline, you know, in the nutritional or medical profession, like, oh, everything in moderation is fine, right? Well, then the patient has also got to accept disease in moderation too,
Mhm.
because everything will happen in moderation, including the bad stuff. Whereas
Yeah.
if we focus on being exceptional and giving
Which
amazing
means
results, I think
you're
that would
trying to
be
say
ideal.
that, yeah. So we're trying to come to a situation wherein we are now rethinking and defining that, as a nutritionist, you are appealing to us that, we should consider first dietary intervention as the first modality of managing a patient with any form of gut inflammation, even if it is a kind of a case of a gastroenteritis, wherein we know, unless there are invasive symptoms like fever, which is going out of bounds, the
Hmm.
first thing that we should basically be doing is referring a patient to a nutritionist who knows how to heal the gut with foods,
Hmm.
isn't it?
That
Unless
would
that
be
inflammation,
ideal.
so, unless the inflammation is so bad that it basically needs some kind of an intervention
Hmm.
to, get the body going down the cascade
Yes.
of,
Yeah.
kind of going into
Yes.
a,
I think we need to go back to the first principles of medication, which is do the least amount of harm. Use
yeah.
medication as an emergency. Use medication as a last resort instead of the first resort. Try
Mhm.
and identify what aspects of this person's lifestyle are incongruent with health, right? Not allowing them to be healthy, right? Talking to them what their diet is like. How much alcohol do they drink? Do they smoke? You know, how their exercise levels are like, what their stress levels are like. All these things have a really important role in somebody's health. But I think what's happening more and more today is that instead of using medication as a last resort, we're starting to just, and I think this is also partly, patients also wanting, when they come to the doctor, they're expecting some kind of treatment instead of wait and watch, They don't feel like they're getting their money's worth necessarily, but I think as a population, we need to think about how do we educate people to realize that health is not found in a pill, right? And that we need to take responsibility for our health and not expect the doctor to make us healthy, right? And from a doctor's perspective, if we start to educate people on what aspects of lifestyle create health and then use medication as the last resort when there is an emergency, I think we'll find a lot of better outcomes.
Right. As a nutritionist who deals with IBD patients, one last question I have for you is, I do understand that there are a lot of people, a lot of nutritionists who call themselves as gut healers. How important and how different is high carb health over all those people who are also gut healers in some or the other way?
Hmm. Well, I don't like to speak for other people, but I think our main area of expertise is teaching people how the body heals, right? How does the body heal itself? And then what conditions do you need to give the body to allow for that to happen? So what kind of food do you need to eat to give your body the best ability to heal, right? How much rest do you need? How do you manage your stress? Or how do you deal with exercise? How much water do you need to drink? All of these things play a vital role in allowing the body to heal itself. And so we use we use food as one of those components of the
Mhm.
making sure that you are giving your body the best conditions. You're giving your body the best type of nutrition, right? You're giving your body the best way of creating health, right? And we are not relying on anything external. We're not going to try and sell you a whole bunch of supplements or probiotics or different things like that that don't work, that there's no evidence behind it working, right? Everything we do is based on evidence. Everything we do is based on what the research shows us is ideal for healing the gut, right? And
Mhm.
then we also look at logic. How does the
Mhm.
body heal, right? We have to observe how the body heals as well, right? When the body
Mhm.
heals, we know that there are certain things that it does every time. It has to send blood to the area to heal, so that's going to cause some swelling. So we have to accept some short-term swelling and inflammation if we want the body to heal. All of these things that we have understood, not only from what happened to Shamiz, but more than 1,000 people that we worked with over the years, has shown us the blueprint of how to get rid of IBD, how to heal from it. And so the main form of difference is we teach you how the body heals itself and how to give the body the right conditions. So what exactly you need to do to allow the body to heal and get rid of the inflammation in a natural way, right? So everything we do is natural. It's allowing the body to work the way it's designed to work. We teach you how the body works, and I think that's what a lot of people aren't doing. Where they're only focusing on um, certain types of foods, certain types of protein, supplements, and and the main focus is how can I get rid of this inflammation as fast as I can, even if it doesn't fully resolve the end organ, which we call what we call end organ benefit, which is have we allowed that organ to heal sufficiently so that if we continue to do the right things, this thing is not going to come back.
Right. So I think it was a very good conversation that we had. And thank you for enlightening, the various aspects of how important it is to customize every patient who comes to you with inflammation, prioritize dietary intervention over medication. And yes, there is a definitive role in not only reducing um, but also reversing and restoring the normal anatomy and the function of the gut with respect to introduction of whole food plant-based diet. So thank you so much. It was a pleasure talking to you, and we look forward to come back to you in case we feel there are other questions we have on other aspects of diet and IBD.
Yes, thank you so much for those insightful questions, Dr. Vrushali, and it's wonderful to be able to share this information and give people, realistic ideas on what they need to do and why fiber is so important if they want to heal their gut and have long-term successful outcomes with IBD. Thank you, everyone, for watching and listening to this new form of podcast that we've created with Dr. Vrushali, which is the Save Your Gut series. What we're going to get from this is a whole lot of different types of questions that we don't normally get asked. So, from a doctor's perspective of what they're looking for their patients. So, look forward to more episodes as we go through and come up with different questions. If you have questions or you're a medical doctor and you have your own questions about what Dr. Vrushali should ask me, please link them in the comment section below so that we can answer those questions as well. And if you've enjoyed watching and listening to this series or this episode in the series, please give this video a thumbs up. If you haven't subscribed to our podcast or our YouTube channel, please do that and click on the little bell notification icon so that you get notified of all future episodes. And if you do have any questions about anything that Dr. Vrushali and I have talked about today, please ask us in the comment section and we'll get back to you as soon as we can. Apart from that, we'd like to thank you very much for joining us. Make sure that you eat plants and lots of them. Take care.